going to get into that conversation in a few minutes' time. First, let's talk a bit about COVID, because people with long COVID will no longer have access to long COVID clinics in some parts of Essex. NHS Mid and South Essex say they're no longer accepting new referrals and they're going to close those clinics at the end of February. Bosses have said patients will continue to be supported in the same way, with GPs referring them to the right services. Well, let's hear now from Dr. Margaret O'Hara, a trustee and research lead of long COVID support. Margaret, thanks for joining us. What's your thoughts on this news?
Good morning. Thanks for having me. It's just a fantasy. The notion that you can remove specialist services and that GPs will just take up the slack, or other specialist services will take up the slack, is wishful thinking. And it's a real disaster for people with long COVID.
And what are you hearing in terms of how people are being affected by long COVID and continuing to be affected by long COVID?
Well, there are people who were infected in the first wave who are in their 6th year, coming up for their 7th year of long COVID. A lot of those people's lives have been completely devastated. They've lost their jobs, they've lost their income. A lot of them are bedbound. There are people who can't leave the house. Relationships are broken down. It's a really, really serious medical condition that needs medical treatment. It needs medical management from specialists. And some of the other clinics in the country, there are some really excellent specialist services in the country who offer physician-led, doctor-led treatments, and along with allied health services. And they're doing really great work to help people to try and get some of their lives back. But around a third of patients, they're finding that around a third of people have just really resistant to treatment long COVID. We don't have specialist treatments. You can be treated for certain symptoms, but until research catches up, and there is a research study about to be published which is showing positive results for actual treatments, until research catches up, people need support. And there are things that can be done to at least improve things. But at the moment, like you say, it's not just in Mid and South Essex. There are other parts of the country where the local health boards have just given up and they're letting people with long COVID down. And it's actually a scandal.
Yeah, what sort of symptoms are we talking about here? Because as you said, this affects everything about how you feel about your life, day-to-day activities, work as well, and all of this is all interlinked, isn't it? What sort of symptoms are we talking about here that people are left with for long COVID and for many sort of months and years to come after being infected?
I mean, there have been over 200 symptoms identified because it's a systemic condition which the virus can get anywhere in your body, essentially, and then it can mess up that particular bit of the body that it's got into. So you can have specific organ problems with heart, brain, kidneys, lungs, skin, anything. But systemically, in terms of how you feel, there's fatigue. Fatigue doesn't really do justice to the disability of it. People have struggled to walk, not because their muscles aren't working, or potentially maybe it is because their muscles aren't working, but because that sets off a reaction that causes them to be ill again. People have headaches, they have breathlessness, they have what's called POTS, which is postural or tachycardia syndrome, so their heart rate is really high and they can't control it, and that makes them really tired as well because they end up hypoxic. They have histamine reactions, so they become allergic to things that they were never allergic to before. People have trouble eating. People are losing weight because they can't eat and they can't digest their food properly. COVID is an absolute disaster for the body. Some people get away with it and you recover and that's all fine. But for others, it just sets off this cascade of reactions which can cause any number of problems. And it can affect you differently every time you get COVID. From a scientific point of view, it's a really interesting condition, but it's not great to be a person who has an interesting condition.
Yeah, of course. And that's when the support and that very sort of specific tailored support is important, isn't it? Margaret, thank you for joining us this morning. Dr. Margaret O'Hara, who is a trustee and research lead in long COVID support. NHS England and the Department of Health and Social Care have been approached for a comment on this, but we haven't had a response. Interested to hear your own experiences around this as well. So as we're hearing, NHS Mid and South Essex say they're no longer accepting new referrals at their long COVID clinic. clinics and they're going to close at the end of February. Is this something perhaps that you've had support through? Maybe you yourself have struggled with long COVID. How's it affected you? What support did you have and how much did that help? We're going to carry on talking about that through the show. We're going to hear from somebody who suffered with long COVID after 8 on BBC Essex, but interested to hear your thoughts and experiences around it as well. The time 7:23. Let's talk about the size of your